Our next presenter is a wonderful Darren Ho from CBRC.
Thanks, Eugene. So my name is Darren Ho. I'm the program manager of the gbMSM Health Network at CBRC. gbMSM standing for Gay, Bisexual, Men Who Have Sex with Men. So I'm going to be giving a brief overview of some of the work that CBRC has been doing over the last year as part of the gbMSM Health Network. So what is the gbMSM Health Network? This program was actually developed as a response to the Provincial Health Officers Report, HIV Stigma and Society, published in 2014. Dr. Mark Gilbert at BC CDC wrote this report along with contributions from CBRC and a number of community organizations and members in our sector. This report provided an overview of what HIV prevention was like in BC for gay men and outlined some recommendations on how we can advance HIV work in BC to be more effective and meaningful. So the priorities outlined in this report are: 1, develop a comprehensive provincial health strategy for gbMSM; 2, better provincial sexual health education strategies in schools; 3, scale up access to HIV and STI prevention and treatment; 4 is to scale up the access and competency in the areas of mental health and substance use; 5 is to combat prosecutorial, you know what I'm trying to say, guidelines for HIV criminalization; and lastly, to increase research, surveillance, and data. So these recommendations include policy-level strategies, structural and behavioral change, and community-level involvement. They're pretty ambitious recommendations that require province-wide coordination of both government and community-led programs. So implementing these recommendations required strategic planning with key stakeholders and decision makers. In doing this work, we considered the extensive knowledge already acquired within communities, and we value the combination approaches that build upon the work of local organizations and public health programs while creating stronger provincial partnerships to increase service delivery to increase the health outcomes of gbMSM. The work that the network does can be categorized into 3 pillars. So I'll explain what we've done over the last year in these 3 categories of knowledge translation, capacity building, and advocacy. And so I'm excited to show you what this looks like in real life. So first, in the area of knowledge translation, we hosted 4 webinars that ranged in a wide variety of topics. All of these webinars are currently available online at the CBRC YouTube channel, and soon to be available on our CBRC online resource library, but our website is currently in development, so you'll find it at the YouTube page instead. At the beginning of the year, Harlan Pruden talked to us about PrEP for Indigenous people. So as we all may be aware, the provincial PrEP program was announced earlier this year, but the message that we as a community failed to deliver was that even before this provincial PrEP program, First Nations and Inuit people have had free access to PrEP since 2013. And so Harlan Pruden hosted a webinar explaining that process. We also covered the topics of HIV non-disclosure and criminalization. We hosted a webinar called Beyond MTV, where we shifted the spotlight off of Montreal, Toronto, and Vancouver to talk about what gbMSM work was happening in Peel, Ontario, Kelowna, and Edmonton. And lastly, we had our practicum student Cameron Schwartz deliver his research on the ban of poppers in a very engaging and well-received webinar. This year, we also produced a series of regional health reports, and these are one-page, double-sided reports that provide an overview of the gbMSM population in the geographical health regions in BC. So these reports present stats compiled from a variety of sources, including the Sex Now Survey, BC CDC, and the BC CFE. And they provide a snapshot for service providers, policymakers, and community members to add context and help support the work in bettering the lives of gbMSM in BC. So if you squint hard enough, you might be able to tell from the picture on the left that the first stat we showed was an estimation of how many gay and bisexual men are in each specific region. And that's because outside of Metro Vancouver, we often hear from potential funders that people we often hear from Provincial funders that there's just no gay men in the area to serve. And so this is a simple resource that not only shows the stats of how many gbMSM do exist in the area, but also shows stats like how many of us are out to our doctors, which is very different per region. As part of our efforts in capacity building, we also partnered up with UBC to develop and launch a continuing professional development online module for family physicians and primary care providers in BC and Canada. So this course is really just an introduction to gbMSM health issues and implications, and it was designed in partnership with all of the regional health authorities, Providence Healthcare, Health Initiative for Men, and CBRC. So this online module was launched in July, and since then I've heard that there has been 77 people who have taken the course, mostly general practitioners and nurses. So we're really glad of our partnership with UBC to develop this tool. So also earlier in this year, when the provincial PrEP program was announced, we at CBRC realized that there was a need to spread PrEP awareness all over BC, not just in Vancouver. So we launched the PrEP initiative, which was in two parts. Part one was PrEP Ed, where we recruited community advocates from each regional health authority region to do a weekend-long training session on PrEP. Here we partnered up with Dr. Mark Hall and YouthCo to deliver this portion of the program. And so what I thought was important to note here was that these guys weren't just learning about PrEP or how to access PrEP or the basics of PrEP. They were also having discussions about how to respond to PrEP backlash and how to respond to PrEP stigma if it ever came up during their outreach efforts. And these guys were getting tips from Dr. Mark Hall on how to talk to their doctors about PrEP, knowing that for a lot of people in rural areas, there was a lot of work to be done in advocating for PrEP and bring awareness of PrEP to primary care providers. Part two of this PrEP initiative was the PrEP outreach component, where the guys from PrEP Ed went back to their home communities in the Fraser, Interior, Northern, and Island regions to educate others about PrEP. So this happened in a multitude of ways. We gave weekly outreach assignments that ranged from making an online social media post to distributing him and Katie PrEP resources at their local community centers. And then one way that we found was super effective was when these guys would put on their Grindr profiles that they were a PrEP advocate and could answer questions about PrEP. So for the guys in the interior region especially, they got a lot of messages and questions through apps like Grindr and Scruff. One participant also posted on Craigslist before the personal sections was taken down that he could help to answer some questions about PrEP. And so we're very proud of the guys who did all of this work, and we're also very proud of the guys who took it even a step further and made appointments with their family doctors to see how much they knew about PrEP and then like sneakily pass them BCCFE's info sheets on PrEP. So throughout the year, we've been staying connected with these 20 folks who ranged in ages from 18 to 60, who were advocating for PrEP in their own communities. And so a lot of them are here today at the summit to continue doing queer men's health outreach work. A lot of our work in the network is also on supporting local programs. This year, we played a role in supporting Menscapes in Parksville, which is run by AIDS Vancouver Island, AIDS Vancouver Island's men's wellness program. So Menscapes is like a community-level summit that Jonathan Degenhart and his team work really hard to put on every year on the island. We also supported and helped deliver hymns Totally Outright for young gbMSM in Vancouver, where we were also able to sponsor some youth from Prince George to attend. And then we also supported and helped the Men's Health Initiative deliver The Gathering, which is a program similar to Totally Outright, but for all ages, out in Kelowna. And then, so speaking of Men's Health Initiative, which is a program based out in Kelowna, one of the things we've been working on our advocacy side of things is called the Interior Sexual Health Initiative. Interior BC currently is facing lack of sexual health clinics since many of them closed down in 2012. So this campaign that we're working on is calling for an increased access to safe, non-judgmental, and confidential sexual health and STI services. This campaign is mostly led by Kim Kinnikin of CBRC and the Men's Health Initiative. Also in BC, we're advocating for better, more inclusive sexual health education in schools. So this campaign was launched just about a month ago, and it's called Sex Ed is Our Right. We launched this campaign in partnership with YouthCo, who published a peer-led report based on what LGBTQ youth were currently feeling about the sex ed that they were getting in schools. The report that YouthCo published found that overall LGBTQ youth are not satisfied with the sexual health information that they're getting in classrooms, and that they want sexual health education that's more relevant and inclusive to their needs. So you can check out our website, sexedisourright.ca, where you can sign a petition calling on educators and policymakers to do better when it comes to sex ed in BC. YouthCo's report on what you think about their sex ed is also available on our website, so please check that out. When the provincial elections were happening last month, we also dedicated some time to respond to the fact that some school board trustee candidates in BC were campaigning with a platform that included getting rid of SOGI 123 resources in classrooms. So SOGI stands for Sexual Orientation and Gender Identity, and SOGI 123 is a set of resources and curriculum that teachers can use to make their classrooms more LGBTQ inclusive. So some school board trustee candidates didn't want SOGI mentioned in the classroom, so there was so we created a public list of school board trustee candidates who were in favor of SOGI. Our future plans for this campaign involve a giant mail-out of LGBTQ inclusive sex ed resources to all of the high schools in BC, so that PE teachers who are currently responsible for delivering sex ed have no excuse not to make their sex ed classes more LGBTQ inclusive. And lastly, I just want to tease this upcoming combination prevention campaign called Check Yourself. We know that in many parts of BC, we're very lucky that we have access to a bunch of different STI prevention tools, and sometimes it can get a little bit overwhelming walking into a clinic and not knowing which tools to ask for. So this campaign hopes to lay out a number of these prevention tools available for us and provide some answers on where people can access these services depending on where they are in the province. So checkyourself.today is the URL of the website, which currently doesn't exist yet, but will exist soon, so keep an eye out for that. And so what's next for the gbMSM Health Network? We want to keep building connections and relationships with more regions in BC. We have some new projects in the works, one of which includes supporting an Indigenous youth who is producing a film on HIV stigma in Indigenous communities. We're working on supporting Travis Salway at the BC CDC launch an LGBTQ mental health directory. And we're also working on a program very similar to Totally Outright called the Smarter Prevention Program, which is more geared for older adults. And then so with all of that, we also still want to create a stronger support network of gbMSM frontline workers in BC. And so we know that there's a lot of work ahead of us, but we're very excited to do it. So thank you for giving me your time. That's the end. And so I'm going to take questions after the next presentations along with the guys from the next presentation.